Welcome to the Nurse Perspective, where we delve into the vital intersection of healthcare, community, and public health nursing practices. In each episode, we'll explore a wide range of topics, from preventative care and health promotion to disease management and community engagement. We'll have special guests talking about specific topics near and dear to their hearts, and individuals with lived experiences, shedding light on the challenges and successes of public health. Let's meet the team, starting with your host.
Hello, my name is Jackie Haley, RN, and I'm the Clinical Section Manager at Two Rivers Public Health Department, and I oversee nursing and all things clinical.
Hello, I'm Jordan Anderson, Public Health Nurse RN, and I am Team Lead on STIs and immunizations here at Two Rivers.
Hi, my name is Rosa Piñon, and I am a Public Health Nurse LPN here at Two Rivers Public Health Department, and my specialty is tuberculosis. I also speak fluent Spanish and English, so we are available if you need us.
Hello, I am Liz Weens. I'm a public health nurse, RN, and I am the lead nurse here at Two Rivers Public Health Department.
Hello, I'm Melissa Kissinger, Public Health Nurse RN, and I do immunizations and disease surveillance here at Two Rivers.
Whether you're a seasoned public health nurse, a healthcare professional, a student aspiring to enter the field, or simply interested in learning more about the critical role of nursing in public health, this podcast is for you.
Welcome back, and thanks for tuning in. I'm Jackie Haley, and today we will be talking about a Health Alert Network update from CDC on Ebola outbreak caused by Sudan virus in Uganda, the increase in respiratory infections that Two Rivers has been seeing in our district, and then our guest speaker will be Jordan Anderson, who will be educating us on HIV. So, first off, hot off the press, a Health Alert Network update on Ebola outbreak caused by Sudan virus in Uganda. So, for clinicians, the CDC is issuing this health advisory. And to summarize the CDC's recommendations for U.S. public health departments and clinicians, it basically is summarizing case identification, testing, biosafety considerations, and clinical laboratories. So currently, there is no suspected, probable, or confirmed Ebola cases related to this outbreak in the United States or outside of Uganda. So this is just something to be aware of. So if you would like to read through that, you can go to the Health Alert Network and read through that full update. On a more local scale, what's been happening in Two Rivers District. So we still are currently in our respiratory season. Influenza A numbers have been increasing steadily from prior weeks. Hopefully we're seeing our peak. The last week of January and the first week of February, we saw higher numbers in our district than in all of Nebraska. The week ending February 8th of 2025, we are seeing lower numbers in the district than overall Nebraska. So hopefully that means that we peaked, but sometimes, they peak and wane. So most like if you have influenza, it's probably influenza A. Now on to monthly education. Joining us now is Jordan Anderson, Public Health Nurse RN here at Two Rivers Public Health Department. Welcome, Jordan.
Thanks for having me.
Yeah. Today we're going to be talking about HIV and AIDS awareness. February is a special month for that. So can you tell us a little bit about that?
Yes. So February has two big days that are important for HIV awareness. February 7th is Black HIV/AIDS Awareness Day. And this day recognizes how HIV disproportionately affects Black people. And the second important day is February 28th. This is HIV is Not a Crime Awareness Day. And this is meant to bring awareness to HIV criminalization laws. And, it's something we don't think about, but criminalizing HIV transmission, exposure, or non-disclosure, some states have laws like that, and Nebraska is one of them. So,
wow.
Yeah.
That is interesting.
Yep.
I mean, I bet that probably came out of when HIV first was.
Yeah. I think there's like 38 states that have HIV criminalization laws. So, that's why we were on a call that said if you in your dating profile, you disclose your HIV status, that protects you from from these laws. So, yeah, yep.
I mean, the more you know, right?
Exactly, right? I know, right?
Well, let's start with the basics. So what is HIV?
Yes, getting back super simple here. So HIV stands for human immunodeficiency virus. It's a virus that attacks the body's immune system, making it harder to fight off infections and diseases. So HIV is spread through contact with certain bodily fluids of an infected person. AIDS is the most advanced stage of HIV. And in order to be diagnosed with AIDS, a person has to meet some specific criteria. So first of all, they have to, be infected with HIV. Can't have AIDS unless you have HIV. And you have to have fewer than 200 CD4 T cells per cubic millimeter of blood. I know that's a lot of, health talk there, but those are the cells that help fight infection. So if you don't have very many of those, you're very susceptible to infection. And then the next thing is you have to have been diagnosed with at least one AIDS-defining illness. So that can be anything like pneumonia, TB, tuberculosis, wasting syndrome, progressive multifocal leukoencephalopathy, or PML for short, and certain kinds of cancers and cytomegalovirus. So you may hear that called CMV. It's also important to note that HIV and AIDS can affect anyone of any age and any gender.
Okay. All right. So how is HIV transmitted then?
Yeah. So like I said earlier, it's spread through contact with certain body fluids of an infected person. So that can include blood, semen, pre-semen, vaginal fluids, rectal fluids, and even breast milk.
Wow.
Yeah. And that transmission can occur through sexual contact, sharing needles, blood transfusion, organ transplants, pregnancy, childbirth, and with the breast milk, breastfeeding.
Interesting.
Yeah, so something important to note is that HIV is not spread by kissing, hugging, or shaking hands, sharing dishes, toilet seats, or doorknobs, and you can't get HIV by coming in contact with objects of an infected person. Right. And you can't get it through the air, water, mosquitoes, ticks, or other insects. So, if a mosquito bites an infected person and then comes and bites you, you're not going to get it that way.
Right. Yeah. I remember when we were kids, and this is going to date. He's going
to date you.
Yeah, it's going to date me. But I remember that, when we didn't know as much about it, it was, them using their own bathroom and water fountains and things like that. Yep. And then I also remember it coming out, hey, you can't get this. Yeah. But then it was almost like we were told one thing and everybody was like, nah, we'll stick to.
You got to retrain your brain, right? I even remember as a CNA, if we had an HIV positive patient, I would get nervous and I just had to retrain my mind okay, I cannot get this, unless we had a needle stick or something like that.
Exactly.
So you take extra precautions, but I'm not going to, get HIV by touching you.
Right.
So, yeah. It is important to note that just because a person is living with HIV, they still can enjoy life to the fullest. Yeah. They can live life just like any other healthy person, and this includes having a partner and having sex.
Yeah.
An initiative called U=U is commonly used in HIV campaigns. So what this means is undetectable equals untransmittable. So if a person is taking their antiretroviral therapy, also called ART, every single day, and their labs indicate an undetected HIV viral load, they cannot transmit HIV. So that's huge, right? And so almost everyone who takes their HIV medications as prescribed will reach an undetectable HIV viral load within 6 months.
Nice.
So, I know, isn't that amazing?
I know. I love technology.
Me too. Love medical advances.
Yes, that's awesome.
Yeah.
So what are some effective ways to prevent HIV then?
Yeah, yep. So in terms of sexual transmission, the only way to 100% prevent HIV and any STI is abstinence. Now, we know that's not realistic. We're humans. Sex is part of life. And so it is important to use a condom correctly every single time. Yes. So you can use a condom, but if you ain't using it right, it's not going to do much.
Yes.
So.
And if you don't know how, we can always help.
Yes.
To educate on that.
Yep. I've done that a few times. So even over the phone, if you need help with a condom over the phone, I'm your girl.
Yeah.
So another great thing that has been developed is pre-exposure prophylaxis. You may hear it called called PrEP.
Right.
And so basically that's a daily pill or an injection for people at high risk of HIV to reduce the likelihood of infection. So it's something you take before you get exposed.
Before you've been exposed.
Exactly.
Yeah.
Yeah. Now, in turn, there's also post-exposure prophylaxis. So that's a short-term treatment after possible exposure to HIV. So, if you came in contact, had sex with, had a needle accident, or someone with something with someone who has HIV, this is something you can take afterward to protect yourself.
So if you are with someone that has been diagnosed with HIV, and they are taking their ART therapy, and they've been past the 6 months, and they're undetectable.
Yep.
Does that partner need to take PrEP or PEP?
It's
is that recommended?
Yeah, so it is still important. They do recommend partners to be on PrEP.
Right.
Just in case, things happen and
Right.
you could convert back. But ideally, no. If you're undetectable, you can't transmit it. But as a partner, they do still recommend.
What else do we have for effective ways?
Yeah, so, we talked about the needle sharing, and
yeah.
there are actually needle exchange programs for people who inject drugs. These needle exchange programs, are ways to prevent these illnesses through needle sharing while, not stigmatizing the drug use. And of course, obviously, regular testing and counseling. So that's
so important.
So important for early detection and prevention, So it should truly be a part of your annual checkup.
Absolutely.
If you're at risk, You are at risk if you are having sex with multiple people. It's not just men who have sex with men.
Nope.
It's everybody. So yeah, it just make it part of your regular checkup.
Absolutely.
It should be as normal as checking cholesterol.
Yes.
So yeah. And also HIV testing on organ and blood donors is conducted to reduce the risk of transmission that way. So those tests are super sensitive. So, we see some positives that in confirmatory testing end up coming back negative just because they're so sensitive in those pre-screenings. And, we talk about it in healthcare, but there are unavoidable accidents like needle sticks. Yeah. And hospitals and clinics have protocols and policies on how to handle such incidences, but not even needle sticks. I mean, if you are in a car accident with somebody, I mean, those can be, bloody sometimes, and you can come in contact with that blood. So, it's just good to be safe. So,
it really is.
Yeah.
Right. And so what does testing and treatment look like for HIV?
Yeah. So HIV testing can be done in a clinic or in the comfort of your own home. So that's super convenient.
Very.
Very convenient. So at home, self-swabbing kits are available online. You can honestly Google at-home STI kits and you can get one delivered discreetly to your door. It comes in plain packaging. Nobody will even know. You do all the things and you send it back in. There's rapid tests, which we actually have here at our office, which is super great. So if someone wants to, do a quick, ours is saliva. So if you want to do a quick saliva test, you can come pick it up and you'll get your results at home. We won't know unless it is reportable now. Right. So all of these HIV labs are reportable. So if something does come back, the health department is notified.
Right.
So,
and that's not to get anybody into trouble or anything like that. We do that with all different kinds of disease investigations.
I mean, influenza is reportable.
Yep.
So
COVID.
Yep.
I mean,
influenza, COVID,
salmonella.
Salmonella. Yeah. So, it's not just HIV. There's a whole slew of reportable conditions, and this just happens to be one of them.
Right. And what we're trying to get at when we do these calls is we're trying to stop the spread.
Yeah.
So we try to get enough information, that way we can stop the spread. And that's with any disease investigation.
Yep.
So salmonella, if you got it because you went to a wedding and you ate the food and there's 20 other people, we need to know what happened with the food. And it's the same thing with HIV. Yeah. So we need to stop, thinking that, it's something bad, a call or anything like that.
Yeah, and as far as STIs goes, it's not even just HIV. Chlamydia, gonorrhea, syphilis, those all get reported to us too. So, I don't want people to think, oh my gosh, the health department's calling me. No, I mean...
We're there for help
we
and to give referrals
exactly.
and make sure that you're doing everything that you can do.
Yeah, and something big we offer is partner services. That's probably the biggest thing we do, aside from offering, just basic education. But, if you're too nervous, too scared to tell your partners, we can do that for you discreetly, anonymously. Yep. All of your information is confidential. And there's great websites too, like tellyourpartner.org.
Yes, I was just gonna say
tellyourpartner.org, you just put in the number that you need the text sent to, and they send it from a completely anonymous phone number, and they get a text, and all it says is you need to go get tested for STIs. So it's, there's really no way for anybody to know where it came from. So
yeah, that's nice.
Yeah. And then, it's important to know that HIV is a lifelong virus. I've said you can live a long, healthy life with that, and you can, but you have to take that med. You have to take those meds every day, or as prescribed. There's new advancements in HIV treatment every single day. So, they're really working on, maybe not a daily pill. Maybe, it's a monthly injection, or maybe, they're working on it. So, you just have to be smart, keep yourself healthy, take your meds, and you can live just as long as anybody else. So, and something awesome that is going to be coming up here in our office is we're going to be rolling out our new STI program. Woo-hoo! So we're so excited. It's been a been a journey. It's been a journey. It's been a journey, and we're trying to get everything in place to get that started. We're super excited. There's lots of, behind the scenes work that has to happen. It's not just as easy as saying, oh, let's do STI testing. No, there's a lot that goes into it, and we just want to make sure that, we can offer the best care and best service possible. So that's coming. More to come on that.
Yes, it's very exciting.
Yes.
Next time, we have Melissa Kissinger, Public Health Nurse RN, and she will be educating everyone about Legionella, along with medical updates both nationwide and right here at home.
Thanks for joining us. Check back in with us next time for more of the Nurse Perspective.